We will join with the Holy Fathers of the Council in proclaiming the restoration of icons in the Church 1,177 years ago. At this time, I call upon our faithful deacon and physician, Dr. John Christakis, who will address us.
I was asked by Father Mark to share a few thoughts with you regarding the coronavirus. So I'd like to spend a few minutes telling you about what we know and give you an update. The virus, as many of you heard, originated in China and now is present in about 90 countries around the world. There are over 100,000 cases and close to 4,000 people, maybe even slightly more by this morning, have passed away from this disease. Should tell you that this disease mostly affects those individuals who are over 60 years old, who have underlying conditions, those who pass away, such as lung disease, heart disease, kidney disease, diabetes, and those that are under 2 years old. Those are also very susceptible, and anyone else who has a disease that may be associated with an immune system that's not functioning normally. The condition presents itself in the following way. It starts off very much like a virus, a flu virus. And so you get the sore throat, you might get a fever, you might even develop a cough. And then the difference between this and the flu is the following. The flu usually comes around 2 days or 3 days after exposure. This particular virus can linger on and stick with you for a while. You might actually even be a carrier of it and never get sick. But that's few people. Only about 1-2% of people can carry the virus and not get sick. The rest of the individuals develop a condition that's associated with this virus, and mostly about 80% of everyone gets better. But 16 to 20% can suffer really serious consequences, especially when this virus infiltrates first through the nose. That's the most typical way that they find it, and it ends up going into your lungs. So one of the discriminating symptoms that I think is important to keep in mind is if you start to develop, if you have a normal cold like a flu, but you start to develop some shortness of breath, that is a very key sign that there's something going on more severe than just a normal flu. You start to develop a cough and shortness of breath. Why? Because it has a great affinity, this virus, for the lung tissue. And once it makes its way down into the lungs, what happens is two things. It invades the lining of the lungs, and then your own immune system, in attacking this virus, sometimes overdoes it. So you get a double effect of the virus directly and then your own immune system. And some of these individuals then will progress into what we would consider a critical state when they require hospitalization, and they require oxygen therapy and even ventilation. And there's no antibiotic. Should tell you there's no antiviral medicine. There's no vaccine. They're going to be working on that, but as many of you have heard, it's going to take over a year to develop a vaccine. And there are some studies going on with some antivirals. They may have something within the next 6 months, but they have to do studies, and that takes a long time. So how do you prevent it? You prevent this, if you can, by using common sense. That's the biggest thing I would suggest. What does that mean? Just like anything else, you need to make sure that you wash your hands, and from there you don't touch your face if you can avoid to. We get into the habit of touching our faces. 15 times an hour is how many times we touch our face. And you stop and think of it, and it's a habit. As I'm sitting here talking to you, I'll be shocked if I don't touch my face, my beard. So anybody, especially with facial hair, women fortunately are fortunate. They don't have to worry about that. But men need to be careful. And once you get your hands infected, which can be off any surface, because this can last on a surface, they say from hours up to 9 days. That's not always confirmed, but that's what they're saying. So that means that you got to clean a lot of things that are around you and keep everything very sterile as much as you can. So once you develop the symptoms, it's important that you don't go out. You stay home. Now, of course, if you develop what I said earlier, some shortness of breath, and you find yourself, getting a little bit dyspneic, we call it, hard breathing, then you have to call your doctor, tell him your symptoms, and he will direct you what to do. Usually, he doesn't want to see you in his office, right? Because you're infected. So it's kind of like a double-edged sword. You're kind of, talking out of both sides of your mouth. On one hand, you want to go take medical care. On the other hand, they don't really want to see you. So you're almost stuck. So that's why you need to inform them that you're coming, because there are areas that they're going to be developing where they can isolate people. All right, so that's the wise thing to do, and that's a good thing to do for public health reasons. So the question then comes up: what about church? Okay. One of the recommendations you're going to see and read is avoid public places. Avoid where there are a lot of large crowds. Well, we're blessed here to have a large crowd in church. But what does that mean as far as us being contagious and being infected? The likelihood, as we know it scientifically, is that you can be infected. We hope and we pray that in God's great mercy, He will protect us, but we still... we say, lead us not into temptation. Let's not just believe just because we're faithful that we shouldn't be careful. So we need to exercise that. And you've all heard about the encyclicals that the Archbishop provided us. But the following is a couple of things you should do. Number one, I would say to you, when you come up to receive Andidero, you're going to be taking it yourselves. Avoid kissing the hands of the priest. Just bow down before him. And any reverence you show, you could do it that way. As far as the chalice, well, that's always been a question. Now, I've been blessed to serve as a deacon for 15 years. And I've consumed, I can't even tell you how many chalices. And I know that I personally have consumed chalices where I know people who've had AIDS and tuberculosis and had pneumonias that I've gone to visit. And I've finished consuming, and I've never, by the grace of God, because that's where we believe it is the body and blood of Christ, and no harm will come from that to us. I've never personally experienced anything, nor have I heard of anyone else who has done and experienced any illness because they've consumed chalice. So when you receive communion, whatever you're comfortable with, but I can tell you and assure you, when we say, with the fear of God, with faith, and with love come forward, the fear of God, of course, is not the fear is of nighttime, because we're going to be scared at night. The fear of God here is the awesomeness of God. And with faith, that this is the body and blood of Christ, and with love, not only our love, but His love towards us. So we walk the walk and not just talk the talk, and we have the faith. But sometimes it's not always easy for everybody, and as clergy, they understand that. But I hope that I've had a chance to answer some of your questions. I would tell you that I was going to be in the coffee hour, but I'm actually going to visit somebody that needs some care. So if anyone has any questions after church, right after church, and they want to meet me here before I leave, I'll be glad to answer any questions.